We talk health now. We're going to have an all-encompassing conversation. First, briefly on Mpox, and then we'll talk about our mental health. But we do know that two more confirmed cases, bringing the total caseload to 4. One additional one from the Greater Accra region and another one from the Western region. Joining us to give us some more insight, we have Dr. Caroline Reindorf Emisa, Deputy Director General of the Ghana Health Service, joining the conversation. Good morning, madam.
Good morning.
It's a pleasure having you join the conversation. So we've heard from the Ghana Health Service, but what are the other details we should know as of today in respect of the caseload? Are we still looking at 4?
Yes. As at yesterday, where we had our report coming in this morning, I must say that I haven't checked because I've been on the airway since 7 o'clock, so I can't speak for this morning. But as at yesterday, we still have 4. We have 4 cases in total.
What results have contact tracing yielded so far?
Yes. So what I can say is, yes, for the cases that we have gotten, we are following them up. So we know where they live. We know who they live with, and we are following up these persons to see if they will develop any of the symptoms that we have talked about, such as the fever, the headaches, and the swelling and rashes, especially.
And it's important that you're mentioning the symptoms because there are quite a number of them that we just might take for granted. Rashes, fever, headache, muscle ache, back pain, and so on.
Exactly so. Indeed, all these are symptoms that are common to a lot of illnesses. So for Mpox, we know that people may take some of these for granted, but we are saying that as soon as you see a rash develop on your face, your extremities, anywhere that you haven't seen on your body, I mean, not that you haven't seen before, but as soon as you see some of these rashes, together with all the symptoms we were mentioning, then quickly your mind should be averted to the fact that could it be Mpox, and you should kindly approach the nearest facility for us to confirm or otherwise.
Right. So how prominent will these be, and which are the first ones to manifest in terms of the symptoms?
So I believe they may all come following the other, not in any particular order.
Okay.
You could develop a headache, you could have a fever, you could feel body aches or pain. Sometimes we wake up, we feel these ones. But as they all come together, and especially when you see the rash, I think for us, that should quickly.
Okay, that should be a signal.
Your mind to, yes.
Which areas are the hot spots or hot zones that you are targeting for now?
So we won't call any places hotspots. It could happen anywhere, but currently we have identified 3 cases in Accra, Greater Accra region, and then 1 in the Western region.
Okay.
Around the Sapa and Swayam area.
And you can say so far that all of this is under containment. It's being contained, right?
Yes, largely. The service has activated all its public health measures, and we have sensitized staff for their own protection. We have also sensitized them towards being able to pick up, so they develop a high index of suspicion and be able to pick up some of these cases. And of course, we are continuing to sensitize the public. I think for us, it's also very important. We need the support of the public because if people have these and they sit home or they do not report, then it makes it difficult for us to be able to test and confirm if indeed they have Mpox or not.
There are some protocols that we all ought to observe to ensure that we are not contracting it. Can you walk us through them?
Yes. So, first of all, we need to heighten our hand hygiene activities. We need to make sure that we are washing our hands constantly with soap and water, the running water and soap. We could use sanitizers, but we all prefer that we wash our hands with soap and water, not that we protect ourselves, so we do not come into contact with persons who have or are showing some of these symptoms or the signs that we can see. Then also we want to also advise people as soon as they develop some of these rashes, they themselves should also be eager to report And in doing that, in moving from one place to the other, we will advise that they cover up themselves. So put on clothing that will cover their hands, their feet, which may be showing or having these rashes, so that they do not, in the process of coming to get help or informing us, also endanger others.
Okay. I would have taken your any other comments that you would like to share. I'm here together with Sweetie Abochi as well. I don't know whether you have any
well, Doc, hi, Doc. I heard you talk about rashes and scabs. I don't know if you use that particular word, but just I'm curious, is there any distinct things that identifies a normal rash and scab from the mpox so that people can know for sure what they have, so there's no discrimination against people unnecessarily?
Sure. So I think what I would like to say is that scars would come after the rashes are trying to heal.
Yeah.
So these are not necessarily what we want to wait for to alert health staff. It is when the rashes come, and these are swelling. I mean, I don't want to use the scientific words, but they may start as vesicles and then they become macula that is a bit enlarged. And you can see them. They're actually above the skin. These are swellings above the skin, which you can see. So we don't want to stigmatize anybody with any scar or whatever. They are not saying that scars show that somebody has mpox. We are saying that when all these symptoms come together, all the fever, headache, body aches, especially the rash that we are mentioning, when they all come together and you have these symptoms, then even that you are not to be stigmatized.
Right.
You are to be supported to get help.
Dr. Caroline Reindorf Amisa, thank you so much for joining us. That's Deputy Director General, Ghana Health Service, bringing us some details on the latest update of the mpox virus here in Ghana. But let's talk about